So good afternoon, everyone. For those of you who are new to this series, I'm Diane Hoffman, and I'm on the faculty here at the law school, and I direct the law and healthcare program. It's my pleasure to welcome all of you here today for the third of our Rothenberg Healthcare Law and Policy Speakers Series. This series was established with funding from the Karen Rothenberg and Jeffrey Seltzer Law and Healthcare Program Endowment, which focuses on contemporary issues in healthcare law and policy. Our first speaker last November, Professor Altachara, spoke on the injustice issues in the allocation of the SARS-CoV-2 vaccine. Our second speaker last month, Dr. Josh Sharfstein, spoke on the politics of public health regulation. Today's speaker, as you know, will be Professor Ruqaiijah Yearby, who I will introduce momentarily. And our fourth and last speaker for this semester on March 31st will be Professor Jessica Roberts, who is the Leonard H. Childs Chair in Law and Director of the Health Law and Policy Institute at the University of Houston Law Center. The title of her talk will be Uncertain Terms, Consumer Privacy in the World of Digital Health Technology. But of course, you are all here today to hear Professor Yearby, who will be speaking about eradicating systemic racism in the government's pandemic response. Clearly, this is a topic that resonated with many people, as we've had over 500 people register for the session today. It is, of course, a very important and timely topic that combines two issues that are each posing great challenges for us as a society and as a country. We couldn't think of anyone better to address this issue than Professor Yearby, who is a professor of law and the founder and executive director of the Institute for Health, Justice, and Equity Center at the St. Louis University School of Law. Professor Yearby received her Bachelor's of Science degree from the University of Michigan and then came out to this area where she concurrently received her MPH at the Johns Hopkins School of Public Health and her law degree from Georgetown Law Center. After completing her law degree, she was an assistant regional counsel at the U.S. Department of Health and Human Services, and then a law clerk for the Honorable Anne Claire Williams of the U.S. Court of Appeals for the Seventh Circuit. From there, she left for a position in the academy teaching health law. Professor Yearby is a specialist in racial disparities in healthcare, the political economy of healthcare, and social justice in medical research. She has dedicated her career to improving the lives of vulnerable populations. Through her research and work with community groups, she advocates for equal access to healthcare and fair wages for racial and ethnic minorities, for women and the poor. Using empirical data, her research explores the ways in which inequities in society and the healthcare delivery system prevent minorities, women, and the economically disadvantaged from attaining equal access to quality health care, resulting in increased morbidity and mortality for these groups. So consistent with that work, as I said, she's speaking to us today on eradicating systemic racism in the government's pandemic response. And before I turn the Zoom platform over to her, let me say that there will be a time for questions at the end of Professor Yearby's presentation. And if you think of something during her presentation, please send it to me via the chat function. So thank you all for being here, and now to Professor Yearby.
Thank you. It is such an honor to be speaking to you today. So I want to thank you, Professor Hoffman, for inviting me, Professor Rothenberg, for including me in this. And with that, I will go ahead and get started with my presentation. So my presentation today builds off of an upcoming paper that I am doing with Professor Sima Mohapatra, who is at the University of Indiana McKinley School of Law, entitled Systemic Racism, the Government's Pandemic Response and Racial Inequities in COVID-19, which will be coming out in the Emory Law Journal this year. It really focuses on the continued failure to provide support and protection for racial, ethnic, and ethnic minorities, as well as other groups, but particularly racial and ethnic minorities during pandemics. And I'm going to talk about this not only just in COVID-19, but also in terms of the 2009 H1N1 pandemic. And so, one of the key things that we see that has stymied the government's response is the blaming of minorities, particularly racial and ethnic minorities, in a way that is very different than how we talk about other groups. And so, when we look at COVID-19 inequities and infections and deaths, many of those inequities have been blamed on individuals, right? And so we can see this in the statements by an Ohio state senator and physician, right, during testimony about the structural problems that led to these inequities, really questioning whether it was something that racial and ethnic minorities were doing. Was it the fact that they weren't washing their hands, that they weren't wearing masks, that they weren't socially distancing, but not sort of this same discussion around multiple instances where we see whites arguing that they have a constitutional right not to wear masks, right? And that leading to a series of outbreaks. What's interesting about this senator that after this statement that he was let go from his position as a physician, but just last month was appointed as the chair for the Ohio Senate Health Committee by his actual cousin. We also see these statements in other places. The former Health and Human Services Secretary Azar talking about that Latino culture was the reason for disparities, ignoring that multiple groups have had family meetings, religious meetings that actually led and can be connected to outbreaks. His response was said more in terms of the CDC regulations and guidance to decrease COVID-19, as well as to the Department of Homeland Security in terms of immigration reform. And so today I am going to talk about systemic racism, the model that we created so that you can see how it impacts and leads to racial inequities in COVID-19. I'm going to talk about health justice as a solution for addressing these issues, give you some examples of how this is actually showing up, particularly in terms of employment and essential workers, and then move on to the final slide, which is solutions. So the term systemic racism has been used more and more throughout COVID. And here's a definition that I will be using today, that it refers to a complex array of social structures, interpersonal interactions, beliefs by which a dominant group categorizes people into races and uses it to dominate or disempower. And so my discussion about blaming racial and ethnic minorities is one example of this. One could argue perhaps that there's not bad intent or neutral terms. Systemic racism does not require that, but it is really about power and it's about focus. So while we're blaming those minorities and racial and ethnic groups, we are not enforcing the laws that actually can protect them. We're not providing them with paid sick leave or other supports that would allow them to actually protect themselves, social distance, and decrease the spread of the disease. There are multiple forms of structural racism. Systemic racism. I'm going to focus on structural racism. And in particular, it's the ways that we use laws to advantage whites while disadvantaging racial and ethnic minorities. And this could be structural sexism as well. I'm focusing on structural racism, but really the ways that laws provide an advantage to one group while disadvantaging other groups. And here I'm going to talk talk about it in terms of key resources, in terms of employment protections. It is also the ways that trade associations and institutions work together to influence the government's pandemic response. And as I mentioned, I'm going to talk about that a little bit more later. And so this is the model. It helps me because I'm a very visual person. And so, as I mentioned, right, in terms of how racism here, particularly structural racism, impacts the government's response. And so, I'm going to focus today on employment and particularly the way that the government's pandemic response has either not enforced health and safety protections that would protect essential workers, not provided them with paid sick leave, even though we passed a number of economic relief laws, and that has led us to racial inequities in COVID-19. And so these are issues that cannot just be addressed by telling people to put on masks. These are also issues that we have seen in other pandemics. So when we look back at the 2009 H1N1 pandemic, many of these same groups were impacted disproportionately by H1N1, either infections, hospitalizations, or death. And research showed that a majority of those disproportionate impacts were linked to structural issues, the lack of paid sick leave, also blaming people for the disease instead of actually protecting them, not providing respiratory, not enforcing health and safety laws to protect them from respiratory illnesses. And so, how do we begin to address this? One of the ways that my colleagues and I have argued that the government can address these issues is by adopting the health justice framework. The health justice framework has three components, and it's founded really from the civil rights movement, the environmental justice movement, and goes beyond our traditional notions of law as just a negative right, but really providing positive right supports for communities and involving and empowering communities to play a role in developing the strategies. And so the three particular components, the first one is structural remediation, that legal and policy responses must address the impacts of systemic racism on communities. We can't just pass stay-at-home orders or mask mandates without also addressing systemic racism and the things that keep them from being able to comply with the law. That moves us to the second point, is that you also need to provide financial supports and accommodations for people to comply with mask mandates and stay-at-home orders. And finally, the community should be empowered and engaged as leaders to define how we are going to address COVID-19, and even most recently, how we're going to allocate the vaccines and get people the vaccines. And so for you that are visual, you'll see that it included the three particular components of health justice in this model to show you where they actually go. So when we're talking about structural remediation, the first prong, that would be really laws and policies trying to address and eradicate systemic racism and engagement empowerment of communities, that they would be involved in defining, developing, implementing, and evaluating the government's pandemic response. And that finally, we need to provide financial supports and accommodations, which will allow them to have equal access and protection under these resources. Now, today, as I mentioned, I'm going to talk about employment. In our article, we also talk about healthcare. And if you have questions about that at the end, please feel free to ask me. So I'm going to highlight three main points in terms of the government's pandemic response, and it's linked to unequal access to employment resources. The first one being political decisions about who's an essential worker, but then failing to provide support for those essential workers to stay safe, including paid sick leave, the pandemic workplace response that disregards workplace infection and the failure to enforce health and safety laws. And then finally, prioritizing profits over the lives of workers. And so when we think about essential workers, these numbers are as of February the 10th. A majority of essential workers come from two industries, one, healthcare, and the second one is food and agricultural. I'm going to focus on essential workers from the food and agricultural industry. About 45% of the workers are low income, 80% of the frontline workers, so those working in the plants, are people of color, and 52% are immigrants who, many of who are undocumented. As you can see by these numbers, a majority there are lots of meat and poultry processing workers. They tend to fall working for the big four groups, and we see how they have been impacted. Why this is important is because the meat and poultry processing trade associations and corporations lobbied the government to get their workers on the essential critical list that was issued by the US Department of Homeland Security. That list was supposed to be just advisory for the states. The states retain the rights to decide and how to address public health emergencies. But the groups lobbied the Department of Homeland Security and the US Department of Agriculture to use that list as a way to push states to ensure their workers were considered essential. This is important because, as we know, essential workers continue to go to work even if there is a stay-at-home or a lockdown order. Now, clearly, we can understand the business reasons for trade associations wanting their workers to be on the essential critical list. But at the same time that they were lobbying, they were not providing workers with the supports to ensure that there was no workplace spread. And what am I speaking about in particular? That many of these workers do not have access to paid sick leave. Paid sick leave is important for lessening the spread of all types of infections, but particularly COVID-19. And this same structural issue, the lack of paid sick leave, was associated with increased rates of infection, hospitalization, and death during the 2009 H1N1 pandemic. Many other workers lack paid sick leave. Why? Because during the collective bargaining times, lots of these workers were either left out, many of them are undocumented immigrants, and so they don't have access to paid sick leave. The CARES Act, one of the COVID economic relief bills that was passed, does not apply to these workers. One, because it applies to businesses that employ less than 500 workers, and many of these corporations and employ more than 500 workers. Additionally, many of the workers are undocumented immigrants. We see that as a result of the lack of paid sick leave, and research shows this, that working people without paid sick leave are 1.5 times more likely to go to work with a contagious disease and 3 times more likely to go without medical care compared to those with paid sick leave. And this is on top of other issues that have increased rates of infection of COVID-19. We see that a majority of the cases in meat and poultry processing workers are within racial and ethnic minorities. As you see, 50% of COVID-19 cases occurred in Latinos, 19% occurred in non-Latino Blacks. And this, again, is because we have structural racism, right? We have the lobbying of groups to force their workers on the essential critical list, but not providing them with the employment benefits that they need to stay safe, including lack of paid sick leave. Many of these workers then go to work sick, spreading it throughout their workplace. And what tends to happen? We have racial inequities in COVID-19 because those are the workers who are on the front line working closely together. Um, Let me give you another example, which goes along with the lack of paid sick leave. So, don't have paid sick leave, but even if you did, you can only take off a set amount of time. And so many of the workers in many of the plants, JBS and Tyson employees have reported that during the COVID-19 outbreak, that many of these companies are still enforcing their point system, which means that if you take off work, that you accrue points for not showing up for work. You could only get back these points if you have a doctor's note saying that you have COVID and calling into an English only attendance hotline. And so, even if you're feeling sick and you need to take off because you want to go get tested, that is not covered. We can see how this plays out, particularly in terms of one facility. We have JBS Greenlee in Colorado, a plant where 6 workers died and 290 were infected in April. And we see that continued, outbreak continued all the way until October, 1 month after they had stopped that initial outbreak, we see 70 people infected. At the plant, they, before COVID, had 7.5 points that you could accrue for missing work. During COVID, they actually decreased that amount. And so we can see clearly here a link between sort of this pandemic response, the failure to provide equitable employment protections, and increased rates of inequities in COVID-19. JBS isn't the only one. One Tyson plant actually does not approve prearranged absences for things such as COVID testing unless it does not affect the production needs of the plants. I'm going to move on to the pandemic workplace response. And why I'm highlighting this is because it has been very different in how the government has responded to just the general public versus essential employees. And so the CDC guidance that you see is what is current. They've changed it a couple of times, but just the guidance regarding their community mitigation efforts, right? If people come into contact with somebody, they're supposed to, who is infected or believed to be infected with COVID-19, they're supposed to stay at home for 14 days. If you actually have COVID-19 yourself, you're supposed to stay at home 10 days after symptoms first appeared. And of course, there's additional things. But when the CDC issued its joint guidance with the Department of Labor, what it told employers is that they should consider modifying their sick leave policies that ill workers stay home. So the general public, we have a mandate that you need to stay home so you don't spread it. But when we're talking about essential workers and essential employees, we don't have that same requirement. What do we think that happens? Well, what tends to happen then is that the infection spread throughout the plant, and not just to the workers, but also to their actual families. And so this connects also with the enforcement of health and safety requirements by the Occupational Safe and Healthy Administration. They have rules on the books that say that employers are supposed to provide employees with PPE to prevent occupational disease, also to provide a place of employment free from recognized hazards. And so we have on one instance, the government's pandemic response being very very different about how to stop the spread of disease in the general public versus for essential workers. And then the next instance, we have the agency that is supposed to enforce the health and safety requirements not doing so. Basically saying to employers that if you make a good faith effort, and at least say you're making a good faith effort, not only with these requirements, but also with the guidance we issued, that we're going to believe that you actually are doing this. And so what has happened in response to that? We see that there have been several outbreaks, again, in meat and poultry processing plants and nursing homes and farms. But we see particular outbreaks that have lasted quite a while. And I'm going to use this example of Iowa and the Tyson plant. And so here we had a expansive outbreak at the facility. Why is this important? Because not only were they not complying with the guidance, they were not complying with the general duty standard or the PPE standard. They required workers to work long hours in cramped conditions. They actually transferred workers from a facility that had a COVID-19 outbreak. They failed to provide appropriate PPEs and sufficient social distancing. And so as a response to that, again, right, sort of this pandemic response, we're not enforcing the laws. We're not having the same requirements to stop workplace requirements. We see the employment benefits and protections not enforced. We see an increased rate of infection. Finally, I'm going to focus on the last part, which is the executive order that former President Trump issued. And this is where we really discuss on how there's a prioritization of profit over protecting the lives of workers. So back in April, late May, late April, early May, former President Trump issued an executive order which included draft language from the meat trade associations saying that the USDA needed to ensure that meat and poultry processing plants remained open because there was an issue and worry that meat would become scarce. Now, even though that was the statement in the executive order, there was no mention of stopping exports of meat during this time. And so even though allegedly we were worried about it being scarce, what we see is that that these companies set record exportation of meat outside the United States. And in fact, the USDA noted in mid-June, the total pork exports to mainland China in April had reached the highest monthly total since the agency began tracking that number 20 years ago. And as of July, beef and poultry production were up compared to a year ago. Now, initially, before the executive order was issued, we saw the USDA actually deferring to the states, letting the states address health and safety violations and letting the states actually close down plants to protect workers. After the executive order, the USD stepped in a number of times to push states to either reopen or keep open meat and poultry processing plants that had outbreaks. And I forgot to say at the beginning of the talk, a majority of the statements that I'm making are pulled from the review of emails between the Meat and Poultry Processing Trade Association, corporations, and the USDA, which were released midsummer. And so in the emails, you could see that OSHA and the CDC had actually gone out to investigate a big outbreak at Smithfield plant in South Dakota. And as part of that, the USDA allegedly asked the CDC to change its findings to advisory instead of saying this is what you need to do to address the outbreak, they also pressured South Dakota into having the plant opened up before all the employees were tested and all the results came back. And so this is an example of structural racism, right? Because we talked about the ways that industries, groups, and the laws are used to benefit the companies and disadvantage the workers. And so, how does this show a disadvantage to the workers? 1 month after the order, the number of COVID infections more than tripled, and the number of deaths quadrupled in meat and poultry processing plants. We see that research that was conducted during the same time showed that 6 to 8% of all US COVID cases in the United States were tied to meat and poultry processing plants. And that is not just the workers, that's of anybody in counties where there are meat and poultry processing plants. And in fact, having a plant in the county was associated with a 51 to 75% increase in COVID-19 cases in that county and a 37 to 50% increase in deaths. What they did find is that when those facilities were forced to close, not many of them were, but when they were forced to close, if they remained closed for 3 to 4 weeks, that the COVID-19 infection rates were actually lower than counties without a meat and poultry processing plant. And so that's how they came up with this association of meat and poultry processing plants and the increased rates of COVID-19. This continued opening in the executive order, we've seen many of the meat and poultry processing plants post enormous profits, actually double the profits in Tyson's case from 2019 to 2020. We see the same being the case from JBS. So, what are we going to do about it? So, what we argue in the paper is that we need to use a health justice framework to not only provide supports for the workers to give them a voice, but also address health and safety. So, for the first part, I want to highlight the need to provide paid sick leave. Research has already shown that it's linked, that the lack of paid sick leave is linked to an increased rate of people going to work sick and spreading the infection. We also need to give people hazard pay because it is quite clear that people in these jobs and many of the essential jobs are low wage workers. And so even if you provide them with paid sick leave, they still worry about being able to provide food for their families. A guaranteed basic income, which would ensure that they're not pressured to go to work, that they are protected when they need to report some of these health and safety violations and support their families. Because as we see, it's not just impacting them, but that the infections are spreading throughout their families and hurting their families. Workers should be involved in reforming these policies. So I've given you 3, but it's quite clear that workers need to be making these policies. We often think about passing paid sick leave and say, oh, we'll just send people checks. But people can't necessarily cash checks, right? So what supports do they need to address systemic racism, but also provide financial supports and accommodations to allow them to stay home? In terms of health justice and safety, one of the ways that we can address systemic racism is by publishing an airborne infectious disease rule that applies across the board, but particularly to essential businesses, that they cannot just skimp on the protections that they have because they're workers are undocumented immigrants, low wage, racial and ethnic minorities. We need to provide financial and social supports for people who suffer as a result of safety violations. As you'll note, many of the workers who have filed workers' compensation claims have their claims denied because there's always an issue of where did you catch COVID? We need to address that. And we need to institute employee safety boards that have the power to identify compliance violations. This has been done in LA County. It should be done nationally. With that, I just want to highlight some of the work that we have been doing on these issues, and I look forward to your questions. Thank you.
Thank you so much, Ruqaiijah. That was fabulous, really, and so informative and so interesting. You know, in Maryland, we have a lot of poultry processing, and I haven't heard much about this particular issue there. And although I imagine it is occurring there as well. Um, so while we can have any questions that the audience has, if you would put them in the chat, or I think that's basically the best way to do it since we have so many people on the call. While you're doing that, I just wanted to mention that I see we have people here from really all over the world, from all over the country, from California and Texas and Florida and Brazil and the UK and really all over. So thank you all for being here. It's interesting. I'm interested in the perspective of those of you from other countries. Also, I wanted to mention that some of you asked whether the recording will be shared. And yes, if you registered for the event, we will share the recording with you if you are interested. So one of the questions that's coming up has to do with what about the issue of trust minorities and trusting the healthcare assistance that's offered? How would you respond to that?
Yes, and I can answer that. And then there was one about the focus on racial disparities in healthcare. So this is one of the racial disparities. It causes racial disparities in healthcare. I think, so I have a public health degree, a law degree, and we often talk about the social determinants of health. And so what I highlighted today was how employment is connected to racial health disparities in COVID-19. That because of the failure to provide protections for essential workers, they have increased rates of infection, disease, and death. What you also tend to see, and I can talk a little bit more about the healthcare aspect of it, is not only do they have higher rates of infections and death, they also lack access to healthcare. So at the same time that they lack access to paid sick leave, they often don't have health insurance. They don't have the ability to take time off to get a COVID-19 test. They don't have the ability to take time off to get treatment. And so what tends to happen is then they spread it throughout their communities. We can see across the nation in Indiana and North Carolina that even when they do take off time to try to get tested, that they are often turned away, even when these clinics have been set up to test them. So we saw in Indiana, a nurse actually turning away Latinos, asking them for additional requirements of ID. We see the same thing in North Carolina. And so this is a way where we see racial disparities in healthcare, because it's either increased rates of infection and employment, or they're turned away in terms of getting access and testing. And so how do we deal with the issue of trust, particularly with them seeking assistance? I'm going to highlight it in terms of the undocumented immigrants, and then also speak to it just generally. As I mentioned, some of them have been turned away, but there also is a fear, or at least had been a fear, of them being deported if they went to places. And so, I hope with the change in administration that will be removed. You see many places starting to use mobile units to go out to these communities. Most recently, I saw at a farm that they were working and set up vaccine distribution on a farm, that's what they did. Instead of picking fruit, then they just vaccinated all of their workers. And how great is that? And hopefully they're still getting paid. So that's a way to begin to build trust. In the other parts of our articles, in our article, we talk about building trust. And part of building trust is that ensuring that these workers, that these people have access to testing and treatment. Throughout the COVID-19 pandemic, many of the places that were hardest hit did not have access to testing, treatment, and still don't have access to vaccines. So I can speak to that in St. Louis, in the zip codes that had the highest rates of infection. Many of them did not have testing sites available to them in the first few months. After that, the testing sites then required an appointment or a referral. And so one of the ways that we need to begin to build trust is by getting people access to testing, treatment, and vaccines. That means partnering with groups that are already in those communities and who are trusted. It also means not turning people away. And so I know you have seen lots of stories. I'm going to highlight two where people were turned away who were healthcare workers. There was a woman in Detroit who had worked at a hospital for over 30 years and was turned away twice when she sought care for COVID-19 and actually died. We see the same case from another African American in New York who was turned away, again, seeking treatment. And actually, the EMS told the person that they were having a panic attack and they wound up dying from COVID-19. So building trust is actually providing people with access to care. I'm not going to focus on the Indiana case and the doctor because I think most people are aware of that particular case. Maybe not, because I don't see recognition on people's faces, but there was a African-American woman doctor who was in the hospital from COVID, and she was requesting specific care that she knew that she needed because she was a physician. She was denied, released, and later died. And she did a Facebook video complaining about the care. So I think one of the ways that we build trust is respecting people and ensuring they have access to care. Testing is not treatment, but those are just some examples where people were turned away from testing. You can't get treatment if you're never tested, right? So I just wanted to highlight those key points. And Professor Hoffman, I see a few other questions in the chat. Would you like me to answer them, or are you going to shepherd them?
Well, either way, if you have something that you particularly would like to answer, please go ahead.
Okay, so I'll read this question out. Living in North Carolina, Tyson is a huge employer in Wilkes County, and there have been over 100 deaths from COVID-19 since last March. What recourse do the families have that have experienced loss tied directly to Tyson? So there are many lawsuits against meat and poultry processing workers. Tyson, definitely. I would say that what was interesting for me in terms of the Tyson company is that once there was an outbreak, they immediately began to test as many workers as they could to address the outbreak. What they didn't do, however, was ensure that they didn't transfer workers from an infected facility to a facility where they were not infected. They didn't necessarily provide masks for all the workers. The workers were working closer than 6 feet. And you also see examples, and not in North Carolina, but I think it was in Iowa, where managers were betting on who actually would get COVID-19, and they claimed as a morale booster. Now, what Tyson did, though, was fire the workers. Unfortunately, it doesn't address some of the issues around the infections. So there are lawsuits by families, wrongful death lawsuits. The shareholders of Tyson have also also sued them for their inability to actually address the infections. And there is an investigation by Congress. But to me, what is key and is not changed is the punitive attendance policies. Even if we give people masks, even if we give people paid sick leave, you cannot penalize them for staying home when you're sick. As we know, COVID-19 sometimes appears and makes you sick, and sometimes it doesn't. You cannot penalize people from staying at home. And so I think that's one of the changes that hopefully the Department of Labor will address as they issue new guidance to make it clear to employers that they need to let employees stay home if they are sick.
She's anything else? I don't know that if you have any thoughts about the question regarding the president's task force on health equity and whether that will come forward with enforceable policies.
My hope is that it will. I think that what it tries to do, which has not been done previously, is center communities in the response. So using community health workers, really going to community to listen to what they need, to empower them and to pay them for doing it. And so when you look at the 140-page report that they issued, that came across quite clearly. What I would hope in that is that they would also then move forward with employment policies, health and safety policies that would be enforceable. So to protect people as they're also thinking about health equity. So that is my hope. I think it is possible. I just hope that it comes sooner rather than later because President Biden already issued an executive order for stronger guidance from the Department of Labor. But what I would like is actually hiring more inspectors and more enforcement and more fines for companies that are not complying with the law. So I see also in there, I think airborne publishing health should also allow travel restrictions. I'm not sure about that, but let me try to answer what I think it's getting at. Perhaps one, I think what has not been done by the Department of Labor, which should, is to actually issue rules around airborne infections. And so rules that talk about airborne infections, COVID-19 clearly is airborne and lots of research has shown that. We don't have the rules on the books that address some of these issues, and that if they were if a law was passed on the federal level, that would hopefully allow essential workers to be able to file for workers' comp. And so we see that in some states, in Virginia, where they explicitly say that their health and safety regulations cover airborne infections like that would cover COVID-19. We see in California and Michigan where they've actually passed laws that there's just an assumption if you get COVID-19 and that you're an essential worker, that you got it at work. And so you can actually qualify for workers' comp. And so that would be nice if it was done on the federal level. In terms of travel restrictions, I can't speak to that, but I would say my colleague, Professor Seema Mohapatra, has just written an article on vaccines and sort of vaccine passports that came out in the American Law Review. So I would suggest that you go there.
Ruqaiijah, there's one that's about an employer mandate for the COVID vaccines. And I wondered, I guess I would maybe alter that a little bit and ask, given your health justice framework, how would you think about a mandate, maybe in the meat and poultry industry regarding vaccines?
I would say I don't think that that is the right thing. I don't think that that is the right thing for several reasons, because as we know, the vaccine alone is not going to stop the spread of COVID-19. And so you need other supports. Furthermore, this goes back to, I think, the question about building trust in these communities. Right now, these corporations do not have trust. Their workers are not happy with them because they have not provided just the baseline things to support them and keep them and their families safe. So allowing these employers to then mandate the vaccines while they're not doing anything else to protect workers is not going to be effective in stopping the spread of the disease, and is not going to be something that workers are going to want to comply with. And so what we suggest under the health justice mandate is that if you want people to take the vaccines, then you need to support them to do it, right? Financial supports. So one, that means that they need to have time off to go get it. They need to have time off to actually stay at home if they're suffering side effects. That it actually has to be made available to them without limitations, like in Nebraska, where they said the undocumented workers are not going to get it, which makes no sense, because then that means what, 10 people will get it in the facility and the other 150 will not, right? We're already valuing people's lives. I think it also has to go with testing. JBS, one of the corporations, said that it was going to make testing available for free for workers. But then a whistleblower said they were trying to charge employees $100. And now their policy is they're trying to pay employees $100 to get the vaccine. So that really doesn't go along in terms of values, right? We're going to charge you to get a test. Well, maybe they'll charge them to get a test and then give them the vaccine. And so then they won't have any cost. But clearly you see what I'm saying is that if you are supporting and valuing the lives of your workers, that it can't just be mandating the vaccine. It has to be doing all the other things to support their health and well-being. And that way, to me, it will also increase the uptake of people getting the vaccine. I do want to say, I know this is long-winded, but I am going to wrap up. This is not just in the meat and poultry processing plant workers, right? It's across the board. And agricultural workers at one pistachio farm, the workers actually didn't know that other people had tested positive until they saw for COVID-19, until they saw it on the news. And by that time, once the workers all got tested, all of them had it. And then additionally, 65 family members had it. And so this cuts across multiple industries, right? Grocery store workers, the people driving buses, teachers. If you want them to take the vaccine, then you have to value them, right? You have to give them the financial supports to show them that it's not just a vaccine. We'll provide masks, we'll ensure that there's testing. We have to do all of that to actually stop the spread and to support them in getting it. So.
Maybe one or two more questions. One is on what can be done, I guess, and also thinking about your framework when employees are being harassed by employers for wearing PPE.
Yeah, so I would like to see that more. I haven't seen that as much. I think that right now there's been such a gap in protection of workers. What I have tended to see is that not employers harassing employees for wearing it, but more. So let me take that back. I can think of some healthcare. Some instances within healthcare where healthcare workers have been either fired, disciplined, and actually faced the loss of their license for trying to wear their own PPEs, trying to wear hospital scrubs. And so unfortunately, not too much has been done. You saw some issues, statements issued by some healthcare associations. Some of their unions have sued the OSHA several times, the government several times to protect these workers. I think at since November, December, you see lots of pushback against employers retaliating against workers, particularly hospital workers that are trying to wear PPEs. And so my hope going back to the Biden administration is that these are things that they're going to focus on, implement in federal law, and then support states that are trying to protect workers. But we haven't seen that as much. So lots of employees have been retaliated against for these issues, and hopefully Biden will change that.
Thank you. There are a couple of more. I don't know if you want to answer any of these others.
Yeah, I saw one that says, what happens if a person becomes sick? Will the company pay for their medical care? I saw an article recently about Minnesota, and that a majority of the claims have that particularly meat and poultry processing workers have been denied for workers' comp. The argument is that there's no proof that they got the infection at work. To me, again, this goes back to structural issues in our pandemic response. People are working. We should not be arguing about where the infection actually came from, particularly in a country where we are not doing testing, genetic testing, to be able to track the infection. So we have not sort of instituted a system to be able to track where people are getting it from. If people are working, they're infected, we just need to pay them. But that's not what's happening. And so I can go into the last question, which sort of goes into universal single payer healthcare and the Biden administration. I think it's not just about access to health insurance. It's also access to support to be able to take time off and to be able to get treatment, right? And so to me, it's not necessarily a universal single payer healthcare system, because that is not going to address the fact that many of racial and ethnic minorities, women, are turned away from care, are not provided the same level of care, even when they have health insurance, like the doctor in Indiana who worked for the University of Indiana and was not provided the same care. That we need to take a holistic approach. So if we're going to say, yes, you have access to health care, that then we actually have to ensure that they get that health care.
Great. Well, I think we need to wrap up, but I want to thank Professor Yearby so much for a wonderful presentation and answering all of our questions. We really appreciate your time and all the research you've done into this topic. And I want to thank all of you for attending from all across the country and around the world. And finally, I want to thank Karen Rothenberg and Jeffrey Seltzer for allowing us to have this speaker series. So thank you, everyone, and good evening.
Thank you.